umaga, nagbabalik ang The Morning Show and today we are celebrating World Suicide Prevention Day. At, ngayon kasama natin si Dr. Ricardo Soler, ang founding trustee ng Natasha Goulbourn Foundation. Good morning.
Good morning.
Yes. Do you have statistics? How many Filipinos commit suicide or get depressed here in the Philippines?
The two questions you asked are related. The first way I will answer it is that depression is a very common disease. It escapes us because we don't pay attention to it. But the World Health Organization already has declared that depression is the most disabling disease in the world. Also, starting this year, it is the second most prevalent disease in the world. Now let's look at the Philippines lamang. No? In the Philippines, at least 10% of the population is depressed.
10%.
At least.
So about 9 million Filipinos.
Yes, but that's a very little estimate because we don't keep statistics.
Yes.
We don't have a database. We don't really care so much. Now, let's assume only 10%.
Yes.
Of those 10%, 15% will kill themselves.
Oh, that's terrible.
Depression is the major cause of suicide in the world.
How do you know if you're depressed? What are the symptoms?
Okay, that's a nice question. The first thing is that you feel very sad. But this is not just a temporary sadness. This is not the blues or the doldrums. This is a long term, at least 2 weeks you're sad.
2 weeks.
2 weeks,
2 weeks
straight, you're
continuous,
sad.
Yeah. It must be at least that long. The second is that you have lost interest in the things that you normally used to enjoy. You don't feel like reading, you don't feel like going to the movies, you don't feel like having dates, you don't feel like going out, the boys drinking or the girls chit-chatting. And even you don't feel like having sex. That's how terrible it is. Can you imagine anybody feeling that like not having sex?
Yeah, I'll just
So you have
definitely
to make
not
it
depressed.
at least twice a week.
Yeah. Yeah.
You have to constantly do that at least thrice a week or twice a week in order for you to...
Not to be depressed.
Of course.
But okay.
It's one way of releasing your stress.
Yeah.
What can you do?
Depression.
Yeah, if you're feeling that already, that's the time that you need to go to the doctor and realize, acknowledge that you're depressed.
Depends on the stages, no? There are other things. For example, you don't feel like dressing up, you don't take care of your hygiene. The important things are you feel very guilty.
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 So there's that factor of guilt.
Oh, very big factor. You feel very guilty and you hate yourself.
Okay.
You hate your life,
You
you hate
despise,
everything.
you
Yeah.
hate everything.
So it is vulnerable also for you to take some illegal drugs if you're depressed. So
I'm sorry.
parang ganun po, no?
Yeah.
Vulnerable yan,
Maybe
you will take illegal drugs if
one
you're
of the
depressed.
reasons that you use illegal drugs, narcotics or shabu, is because you're depressed. It's one of the big reasons in America that people become alcoholics. They're depressed and they go to alcohol, not knowing that alcohol will make them more depressed.
Make more depressed.
What should you do about it if you're feeling depressed so that it doesn't turn to suicide?
I came up with this concept when we organized the Natasha Goulbourn Foundation. I realized that what happens is that people don't know about depression. Let me give it this way. Let us say there are 90 people who are depressed. 30% of them will recognize that they're depressed. They're educated, they are brave. They will accept that they are depressed and they will seek treatment. The other 30%, they know they're depressed. But they're embarrassed to admit it because people stigmatize. Baka isipin sira ulo nila. So they keep it to themselves. They don't tell anybody. They suffer in silence because of fear and because of shame. The other 30 also have the symptoms. They suffer the same thing, but they don't know what they have. So they suffer in ignorance. Imagine that. Now, if people only knew the following things, if they knew about depression, the following things. Number one, it's a disease.
You shouldn't be ashamed to acknowledge.
Number two is that a personal weakness. It's not because you cannot cope. It's a disease that is caused by certain dysfunctions, disbalances in your body. We don't know exactly what causes depression.
Hindi po
Depression, there are so many hypotheses, there are so many theories.
But it's triggered by a certain problem. Let's say, walang pera or a problem with relationships. Ganun ba? Hindi.
No. Let's get it straight. Depression is a condition in the mind.
Yeah.
Okay.
Maybe all of us have, it's probably genetic, maybe all of us have that gene, but only some of us, like me, I was depressed.
You were depressed.
Sometimes.
There are some triggers, and those triggers can be very simple. Somebody insults you, you can get depressed. Your girlfriend leaves you, you can get depressed. You lost your job, you can get depressed. You're broke, you can get depressed. These are the triggers.
How about midlife crisis?
I'm sorry?
Does it also trigger
Midlife
depression?
crisis.
Midlife crisis.
Midlife crisis.
I wouldn't think that it plays a great role, but the chances are because of hormonal changes at that time when you have the andropause, the menopause of men and menopause of women, those hormonal changes may probably weaken your genetic resistance and you will be more subject to depression.
But there are certain people who are more susceptible to depression than others, ganun ba?
Well, let's put it this way. Almost every human being, every Filipino, will suffer depression at least one time in his life.
In his life.
How many Filipinos suffer from it? We told you already. I told you already.
But how many people here in the Philippines, well, in Japan and Korea, I think every 15 minutes somebody commits suicide. Here in the Philippines, how often?
Well, at least one Filipino, no, the records are scant. But at least we know that there's one Filipino who dies from suicide every day.
Every day.
How many we do not know is a guess because no statistics. And it's very hard to really count because every time suicide, nagpakamatay, it's just bury him.
Yeah.
It's not a medical legal problem, it's not a crime, so no records are kept. But what's important to note is the Filipino is, the rate of incidence of depression in the Philippines or among Filipinos is the highest in Southeast Asian nations. It is a sad thing that some political reasons came up with a study showing that Filipinos are happy people. They're not.
So walang pinipili po yan. Halimbawa, depressed isang mayaman. Marami naman pera, enough money. Kasi sa Japan, most victims, ito po nagsuicide because of depression, were public officials.
Yeah.
Meron po silang mga pera, no? Sa Pilipinas, hindi po nangyari yan.
Dito hindi. Nag-suicide si Angelo Reyes.
Meron. Pero hindi na
Nag-suicide
wala na
yung
sa...
DBP official, yung DBP lawyer.
Okay.
May mga ganon. Pero,
Okay, let me go a little bit more, no? Depression does not recognize sex, race,
walang pinipili.
creed, age, profession, or economic standing. Some people tell me, Doc, that's only a disease for the poor. And I tell them, tell that to Jimmy Ongping. Tell that to General Angelo
Yes.
Reyes.
So, okay, if you are, you see your child suffering from depression, how do you get the person to be treated? Can that be treated? Or
Yes, depression, contrary to most concepts, depression is a disease just like diabetes. And just like diabetes, it can be managed and treated. So, what do? Number one, you have to know what depression is. If you know that depression is not your fault, if you know that it is a disease somewhere in your brain or somewhere else in your body, if you know that it is not because you're a weakling, if you know it's not something that you can just wheel away or whisk away. You know, it's funny, but people tell if depressive, madali yan, huwag mo lang isipin. Asking people to do that is like kicking a dead horse. Because the more they'll feel bad.
They should get therapy for it. Will medicines help?
That's a big question. That's a big question. Obviously, certain medicines could help, but now there's a big hullabaloo about antidepressants. The latest studies indicate that antidepressants actually do not work. This is a sad thing for an industry that is $18 billion a year. But there have been recent studies, as reported by Newsweek last January 10, 2010, that depressants are no better than placebos. You know what placebos are, right?
Yes.
Placebos are pills. They only work because the patient wants to believe they work. So they have a placebo effect. In effect, they are placebos. But the thing is this, they're worse than placebos because a control test showing a group taking the antidepressants and another group taking only the placebos showed that the people who were taking the group taking the placebos had a higher rate of recovery and what's more, than the ones taking the actual drug. And what's more is that the side effects were less. So it's very difficult to come out, you know, when you don't know what is the causative mechanism exactly and precisely, you don't know how to treat it. For
So we
example,
should-
let's go to the antidepressants. Let's go to the selective serotonin inhibitors. This is based on the premise that the problem of depression is because there is a fault or dysfunction in the production or absorption or uptake of serotonin in the brain. This is only a guess. There has never been any conclusive clinical evidence to support that this is so. For one thing, you cannot measure the serotonin in the brain. But the antidepressants, that's why they're called selective serotonin inhibitors, are supposed to work on the problem of serotonin. But if serotonin is not the cause, then the
Then it's a
antidepressants
wrong-
will not work. It's
correct.
very simple, but there is something about, there are a few things about the human being. Number one, they're very gullible. Number two, they can be fooled all the time. Remember Barnum said there's one born every minute. So we fall for these things. The sad part is the pharmaceuticals are so powerful.
Okay, so we don't have time anymore. Just seek help. That's the most important thing.
Seek help.
Acknowledge it.
No. The most important thing is know what depression is.
Yes, know what depression is.
Thank you
so
so much.
Thank you very much, Dr. Soler. At magandang umaga po sa inyo.
Maraming salamat din.
Okay, mula po kay Dr. Soler, panoorin naman natin ang ambag ng DSWD sa awareness campaign para sa depresyon. Narito po.